Nurses very often administer blood and blood products to patients. We give blood products because the patient requires replacement of whatever the blood product is. And there's something unique about the blood that we administer, at least the blood that carries red blood cells, and that is that this is the only class of replacement fluids that we give that can actually carry oxygen. It's the red blood cells that carry oxygen, so whenever we give a blood product that contains red blood cells, we are helping to increase the tissue oxygenation. Because blood products can include products that actually don't have any red blood cells in them, and we'll talk about that. We can also give blood products that increase colloid osmotic pressure and the plasma volume. I've abbreviated that as PV. And any blood product that's got cells or proteins in it can increase the colloid osmotic pressure. And lastly, when some blood products carry other kinds of substances like clotting factors that the body needs more of. Of course, any blood product that contains red blood cells also is going to include hemoglobin. And for somebody who's seriously anemic, that will replace needed hemoglobin. Of all of the fluid replacements products that nurses administer, blood products are the most expensive, and they are in the most limited supply because they come from human donors. The colloid fluids, other colloid fluids, and crystalloid IV fluids can be made in the lab. In the manufacturing plant, I should say. And so they don't require human donors like blood and whole blood and other blood products do. We're going to break down the different types of blood products that we administer and describe how it is, what it is that patients might need them for. So we can administer either whole blood or packed red blood cells. And when we talk about packed red blood cells, we mean that we are administering red blood cells in which the fluid volume, the plasma volume, has been reduced. Most of the plasma volume in a unit of packed red blood cells has been removed. The cells have been spun down or centrifuged, and a lot of the fluid volume is removed. So when you compare the if you want to call it that, the hematocrit of a unit of packed red blood cells to an actual human hematocrit, the percentage of volume that's packed red blood, that is red blood cells in a unit of packed RBCs, is like 60%. It's pretty dense with cells and relatively little plasma in it. And so packed red blood cells are given to somebody who has got significant anemia, or they have lost a lot of red blood cells, and so they have a big time hemoglobin deficit, and they need their oxygen carrying capacity to be improved. It's also useful in people who've had some blood loss, maybe up to 25% of their total blood volume. In other words, they've lost blood, but it hasn't been a massive blood loss. So primarily we're given the packed red blood cells for the red blood cells and their oxygen carrying capacity with some plasma volume contained. Whereas, by contrast, we would give whole blood, a unit of whole blood, to somebody who'd lost a lot more blood volume, because in a unit of whole blood you've got all of the red blood cells, but you've also got plasma volume. And plasma carries so much stuff. Plasma carries the electrolytes, plasma carries the proteins like albumin, plasma carries clotting factors. There's just a lot of stuff in the plasma in our blood that if we lose a lot of blood, we are going to lose, and we're going to miss it. So the second bullet here under whole blood is what I just said, that plasma proteins in the whole blood will also help in somebody who has who's lost a lot of blood, and so their fluid volume in their body overall is depleted, it can help pull fluid out of the surrounding tissue into blood vessels. So, packed red cells versus whole blood. The packed red cells has red cells, the whole blood has red cells, but the whole blood's also got more plasma in it. We can give patients a couple of products called cryoprecipitate and then also plasma protein factors. And these two types of blood products are indicated for patients who have also lost a lot of blood, 20% with a major acute hemorrhage, or even 50% if it's been a slow blood loss, like a slow bleed from a diverticulitis or inflammatory bowel disease in the bowel. You can see I just added a little more detail to the slide, and I also corrected, I had written previously plasma protein factors, and correctly it should say plasma protein fraction. So what will these two blood products do for somebody who's who's lost a lot of blood? Cryoprecipitate contains clotting factors. And so for someone who's actively bleeding, it can help slow the bleeding. The plasma protein fraction contains albumin and globulin, and those protein molecules, when administered to the patient in the bloodstream, they will help by increasing the osmolality, will help to pull blood out of the interstitial space, for example, and try to restore the circulating volume in the vascular space to prevent shock. Somebody who has lost a lot of blood can go into shock, and so these two substances can help slow the bleeding and also reduce the risk of shock. And then the last blood product that's described in your textbook is fresh frozen plasma. And fresh frozen plasma also is fresh plasma. It hasn't been spun down. Cryoprecipitate is plasma that has been partially spun down to concentrate the clotting factors in it, whereas fresh frozen plasma is just plasma. It's somebody's plasma. They donated blood, and the cells were largely removed, and the plasma was retained, and it was frozen. And so it also has clotting factors and other plasma substances, including protein, for example, and albumin and globulins, that will help restore somebody's clotting factor level in their blood. I did, however, regarding fresh frozen plasma and the fact that it contains albumin, find a source, a reputable source, that said that fresh frozen plasma is not a go-to blood product for as a volume expander. In other words, its primary use is not to increase the circulating blood volume. Its primary use is to get the clotting factors into somebody who needs them. So whole blood, packed cells, cryoprecipitate, plasma protein fraction, fresh frozen plasma. There are some other blood products that are not described in your textbook. Platelets can be retrieved and administered to people, for example. But when we're giving blood products that contain cells anyway, we are very concerned that our donor blood, our unit of blood or blood products, is compatible with our recipient. Because you know that our cells have cell surface antigens on them and that they're unique to us. And so when our cells are given to somebody else, those cell surface antigens on our cells are recognized as foreign by the other person, and they develop antibodies against them. And so we're very concerned about compatibility of donor blood with the recipient. So the blood of the donor and the blood of the recipient is typed, and it is carefully cross-matched to make sure that to reduce the risk of incompatibility reactions to as low as we can possibly make them. And then whenever we're giving a blood product to somebody who has who isn't terribly fluid deficient, we have to worry about fluid overload. And even when we're giving a blood product to somebody who is fluid deficient, but maybe they have underlying kidney or heart disease such that their fluid and electrolyte balance isn't regulated like normal people's or healthy people's fluid and electrolyte balance is regulated, we need to watch carefully our patient's blood pressure, pulse, and so on to make sure that we are not overloading them and overstraining, for example, a heart that isn't as healthy as it could be. You will learn more about that in your med-surg nursing courses.